Welcome to Cincinnati Cancer Advisors Medical Minute. Our host today is Dr. Abdul Jazieh, featuring Dr. Robert Franklin of the University of Cincinnati. We're proud to welcome our first industry sponsor, Johnson & Johnson Innovative Medicine's U.S. Precision Medicine team. Precision medicine at J&J is working to advance cancer care across multiple diseases with biomarker-informed treatments in oncology. The Precision Medicine team consists of industry experts who partner with our customers to alleviate practice gap roadblocks in testing through education, partnerships, and access. Now, here's Dr. Jazieh with today's Medical Minute.
Hello, everyone. Happy New Year. It's my pleasure to welcome you to a new episode of Medical Minutes. And it's my pleasure actually to start this year episodes by hosting a very dear friend and expert in cancer, Dr. Robert Franklin, an assistant professor of genitourinary at University of Cincinnati, and he is the lead for the disease group of genitourinary cancers. And today we are going to cover a very important topic, which is basically bladder cancer. Welcome, Dr. Franklin.
Thank you so much for having me, Dr. Jazieh. Glad to be here.
It's a pleasure having you, actually. Let's go ahead and get started and ask about how common is bladder cancer and what are the symptoms of this disease? How the patient will know that he has cancer?
Sure, it's a great question. It's a fairly common cancer, not as common as some of the other ones we think about, but it's about the 10th most common cancer nationwide in America. It is more common in men historically, but that may be shifting a little bit. And it has historically been largely a smoking-related cancer. Obviously, there are some times where it happens without smoking. But it is common enough that oftentimes many of us will know someone or someone who knows someone with bladder cancer.
And how do the patient present? What are the symptoms usually? What do they feel or notice?
Sure, great question. So oftentimes the first presentation will be blood in the urine. It may be painless. Sometimes someone may notice this when they're going to the bathroom, and they may go to their primary care doctor and say, this happened. And their primary care doctor will oftentimes get an image, which will lead to evidence of a mass. And I want to be clear, not every time there's blood in the urine, it doesn't mean there's necessarily cancer. But that is oftentimes the first sign that we might catch some form of early bladder cancer.
And then if the patient has blood in the urine, what would be the next step, and how do, as a doctor, diagnose the bladder cancer?
Sure. And again, this often happens either in the primary care clinic or someone may be referred to a urologist, but oftentimes they'll get a CT scan, which will look for a mass, and a urologist will oftentimes use a camera, just like a GI doctor might use a camera to do a colonoscopy. A urologist may use a camera to investigate the inside of the bladder and the urinary tract and see if there's any obvious tumors present. Other imaging may be done, but that's usually the first step.
Okay. So now let's say the patient was diagnosed with bladder cancer. And can you give us an overview? How is usually the bladder cancer is treated in general?
Sure. It's a great question, and it is a little bit dependent, like most cancers, on whether the cancer's caught early or late. Bladder cancer is a unique cancer in a lot of ways because, unlike other cancers, we can actually access the tumors, what we would say topically, meaning we can actually visualize them with a camera as opposed to having to use a scan only to look at them. And as the urologist can visualize these tumors, they will go in, and if they see one, they will remove it to figure out what it is. If it's an aggressive-looking cancer, a non-aggressive-looking cancer, if there's multiple tumors. And based on those results, oftentimes we will get additional tests, whether it be systemic imaging or molecular testing, to figure out if the disease may be metastatic. But really, the treatment's going to largely depend on, is the tumor early and non-aggressive in the bladder only? Or if it's more aggressive, could it have even already have spread outside of the bladder, which would be a very different type of treatment?
Yeah, so is it like divided, the local one divided into muscle invasive or non-muscle invasive, correct? Because this is very important differentiation even before it's spread outside.
Absolutely. And this is really where I think with bladder cancer, we have a unique opportunity to help patients get access to diagnosis early. I would urge anyone who has these signs of blood in the urine to tell their doctor to get to a urologist to have their bladder looked at. When we catch these tumors early, as you mentioned, they can be what we call non-muscle invasive, which means that the tumor has not yet quite spread into the deeper layers of the bladder, which is a big muscular organ. This is, if we're going to have bladder cancer, this is the ideal time to find it. This is before it's been able to access all the blood vessels and the means of spreading throughout the body. And sometimes it can be as simple of a fix as the urologist cutting it out within the bladder, no major surgery there. An office procedure, really. And we have additional things we can add to that, or the urologist can add to that, that try to augment the immune system to try to keep any tumors from coming back once they remove those small tumors. And as anyone who has these types of bladder tumors knows, this can sometimes happen multiple times. They may come back, and the urologist may cut them out again, and they may get more immunotherapy. And the whole goal of this is to prevent the tumors from becoming more invasive. If we do happen to find them having invaded the muscle layer, which we call muscle invasive bladder cancer or stage 2 bladder cancer, or even sometimes stage 3, meaning it's invaded through the bladder wall, we will typically try to be more aggressive. The distance between that and metastatic bladder cancer is shorter, and so we will be more aggressive with other types of therapies, which I'm sure we'll talk about.
Yes. So now, if the bladder cancer spread outside the bladder, so it became advanced or metastatic cancer, what are the treatment, in general, the treatment available for this disease when it's spread outside the bladder?
So it's as fascinating of a question as it's ever been in this field, due to really major advances in the last 5 to 7 years. We've had a very standard toolbox of treatments for the last probably 40 years in the form of what's called platinum chemotherapy. And really, in the last 2 or 3 years, we've had some major developments with some drugs that are more targeted. They're called antibody-drug conjugates. These are drugs that actually take the chemotherapy we've historically given, or drugs like chemotherapy, and instead of putting the raw chemotherapy into the body, we can now couple the chemotherapy to antibodies, deliver that chemotherapy to cells of interest that we know bladder cancer expresses, and really have, one, a more profound effect in terms of how strong it is on the cancer, and importantly also, it is typically a lot safer for the patient because no longer is the chemo going everywhere. It is now being delivered to those cancer cells primarily. We will oftentimes couple this also with some drugs called immunotherapy that we will put in the blood, and these drugs help to augment our own body's immune system to attack the cancer as well. And there's some thought that these drugs probably act synergistically. They work together and actually work better than they would independently. One breaks up the tumor, one helps the immune system keep the tumor under wraps.
Yeah. So the immune therapy usually help the immune system to attack the cancer, does not attack the cancer directly, correct?
That's absolutely right, and that's the really beautiful thing about immunotherapy.
Yes. So now we know a lot, and we hear a lot about precision medicine, precision oncology. How is the precision oncology applies in bladder cancer?
Yeah, it's such an exciting time in this regard for bladder cancer. I'm biased. But I think bladder cancer is one of the most exciting cancers to be studying right now, doing research in. And that really goes all the way from the non-muscle invasive bladder cancer state all the way to the metastatic bladder cancer state. So, in the non-muscle invasive state, we've really only used one drug for about 50 years. It's called BCG. It's the same thing that we use to vaccinate people in other countries against tuberculosis, which sounds strange. But the idea behind that is things called mycobacteria, like tuberculosis, are very immunogenic. They make our immune system quite angry. And a very smart urologist in the 1980s or 70s realized this, and he said, I think if we put this in the bladder for bladder tumor patients, we can get a great immune response. And he really helped a lot of people over the ensuing 50 years. What's fascinating to me is we are now entering an era where, partly coupled with the shortage of BCG, but also coupled with advances in technology, we can now do what's called gene therapy and introduce vectors into the bladder that recruit the T cells within the bladder to attack the cancer in a way that doesn't rely on using sort of an infectious disease agent. We're also realizing that bladder tumors, when they develop, have different what we would call molecular signatures. So in early stage bladder cancer, oftentimes will be driven by a genetic mutation in what's called the fibroblast growth factor. Not to go too far into the details, but the nice thing about identifying genes in cancer is we can target those genes. Like we mentioned earlier, some of these antibody-drug conjugates that are coming out, they target something called Nectin-4, which when we initially started studying that drug, didn't necessarily know bladder cancer was going to be the most expressive tumor type, but certainly the data showed that it was the most responsive, and now that has really changed the field. As in many cancers, and many patients may know about this from breast cancer, but the bladder urothelium is also heavily dependent on a process called HER2 upregulation, and this is another avenue where we're starting to see some really profound results. And I think there will only be more and more subtypes, molecular subtypes of cancer as we move forward in bladder cancer that will allow us to treat the patient individually, their individual cancer based on their the way their cancer's evolved, and hopefully, increasingly, even in the metastatic state, start to get rid of these cancers in a way where they go away and they stay away. And some patients, fortunately, are already starting to see that.
Very fascinating, actually. It's quite exciting to see that treatment of bladder cancer is catching up with the precision advancement in the precision medicine and understanding the disease better. Thank you very much for very enriching discussion. And to summarize for everyone, please avoid smoking, because smoking, number one cause of bladder cancer. 50% of the bladder cancer are caused by smoking. If you notice blood in the urine, please see your physician, because still earlier discovery of the cancer, earlier detection is the number one predictor of better outcome. And then if it happened that you have a advanced bladder cancer, do not give up. There is a lot of advances. Make sure that your doctor check the cancer genetic testing, and make sure that you know exactly if there are targets that your doctor can use available treatment to use it to fight the cancer, or a new research study that innovative enough to aim to treat these new targets. Thank you very much for listening, and see you in the next episode.